chemical agent used to destroy all recognized pathogenic microorganisms, but not all microbial forms. Example, bacterial endospores. Asepsis is the prevention of microbial contamination of living tissues or sterile materials by excluding, removing, and killing microorganisms. So that is all about our infection control related to the standard precautions, which are the sets of infection control practices and to control and prevention and preventive measures. Talking about COVID-19, there is like information to add up. This is just information regarding the COVID-19. COVID-19, as everybody knows, it is an infectious disease caused by a newly discovered coronavirus. The new coronavirus is a respiratory virus which spreads primarily through droplets generated when an infected person coughs or sneezes, or through droplets of saliva or discharge from the nose. There are signs and symptoms for the COVID-19 patients. We have fever, dry cough, runny nose, difficulty of breathing when it is already into how many days, and headache or diarrhea. But nowadays, just recently from the Communicable Disease Council, they have issued, another symptoms that they have included for the COVID-19. They are the skin rashes and the ulcerations in the mouth. Infectious droplets and droplet nuclei travel lengths. So we have, that's why we are urging the individuals to keep distance, because the infectious droplets, it reaches or it travels at least 5 to 6 meters. So minimum is 1 to 3 meters, then 3 to 5, then 6 to how much farther you can go. How to prevent the spread of COVID? Number 1 is the proper hand washing and frequent hand sanitizing, proper cough etiquette, social and physical distancing, 1.5 to 3.6 or more, avoid crowded places, no sharing of personal things, always wear face mask, and use gloves only when touching dirt or contaminated surfaces. How to prevent the spread of COVID? Number 8, we have asymptomatic. If those persons, if you do not have any symptoms, continue to practice the preventive measures. You are asymptomatic and there is no symptoms. If you have symptoms, so you will be symptomatic. If you have the symptoms, you have to do the PCR test swab, and immediately isolate yourself. Nowadays, with the Department of Health, they have the protocol that they will be calling you once they receive that you are positive with the result. So you will be called by a DOH agent. So you will be transferred either to be isolated in the hotels, in the designated healthcare facility of the government. You will be placed there for at least 14 days and you will take another PCR test swab. Positive PCR test swabbing result, contact the health authority immediately, or the DOH agency will be the one to contact with you. This is the coughing etiquette. You know how to do it. So whenever you cough or you sneeze, you have to use your handkerchief. If you don't have handkerchief during the time you cough, you better hand sanitize after that. Okay, so throw it properly, dispose it properly, and hand sanitize after. So thank you. This is all for our infection control and prevention. So I hope that you have, taken a lot of information regarding infection control.
Yes. Well,
So how did you find the infection control lesson?
wala
If we
sumagot.
are to take this, huh? If we are going to take this in a private, if you will go alone for a CME, it will cost 200 and 250. Okay? So, it is mandatory for us to have the infection control certificates. So what we are doing in our healthcare facility, so as I told you, the infection control nurse in charge and the quality officer, we both go together for a training for 1 day or 2 days. Then we will be paying at least for 2 only, and we will retrain our staff in the healthcare center.
Thank you
So
for
at
sharing
least
with
we
us.
will be,
Thank you for sharing with us.
Thank you for sharing.
that's why
We
we
said
are being
250.
updated. 200 or 250. Sa akin na kayo magbayad.
It pays already our tuition, ma'am.
So this is what we get with the infection control training. The same way how we are, giving you the training, the lesson. So we are doing the same in a healthcare facility. And in the level 4, we are going to have it as in practical. The hand washing and the hand sanitizing. So all of those that requires the physical assessment and skills assessment, we will be doing it in a lesson 4. Like the bed making, like positioning of the patients, hand hygiene, hand washing, all of this. So we will be trying to do it during our lessons, physical, actual lessons. Okay, so how did you find it? Find
Very
it
interesting.
okay? Interesting? So there are lots and lots of infection control practices, infection control precautions, but these are the standard. Even if you go to US, to Canada, to Europe, you will be seeing the same standard. This is the training
Ano pong ang
requirements.
ginagawa kung halimbawa na-prick ng hepatitis needles yung nurses or yung staff? Ano po, nasa loob na po ng katawan yun. So ano po yung, I'm just parang very
curious ka lang.
Curious kung naandun na sa loob, ano po ang protocol normally? Kung na-prick na, nasa vein na yun.
The standard process kasi, once somebody is been pricked, so ang gagawin namin, automatically, we will take a specimen, blood specimen from the infected, not infected, yung affected person at saka yung pinaggamitan ng needle. Like yung patient na yon, pababalikin namin siya, we will take a blood from her. So if the result comes out as negative, fine. We will not do anything. But we have the incident report showing that once this nurse has been, pricked by a needle. But if it comes positive, so we have a protocol. Number 1, you have to go back to the doctor, and the doctor might order with you immunoglobulin. There is immunoglobulin that is being given for those infected by the needle prick. So this is it. And I think it is 3 months after, you have to be checked again. You have to check your hepatitis profile. If it will
The antibodies,
negative
right?
or it will, yes.
Yeah.
This is the immunoglobulin for antibodies. Okay, this is the protocol.
Yung injection, yung hepatitis bacteria.
Ayun ma'am, sorry, I did not hear you. Parang may maingay sa background.
Yung pong immunoglobulin, kasi yung pong anak ko dati, bibigyan din niya nung nagkaroon ng idiopathic thrombocytopenia. Very curious na po kasi parang medyo frightening. So, kung naano na po yung bacteria, paano po yung immunoglobulin parang sa immunity, di po ba? So, it doesn't stop like ipapatayin yung bacteria na napasok sa loob ng katawan.
Yes, ma'am. I mean, halimbawa, kailan, when does it happen? When that happened? Kailan pa yun?
Matagal na po yan. Kaya lang po may idea po ako sa immunoglobulin kasi nagkaroon po ng idiopathic thrombocytopenia yung anak ko.
That's different, ma'am. Walang kinalaman yung iyo doon. Ang ITP is different, ma'am.
Opo.
Hindi siya connected or related doon sa iyong hepatitis or something.
Opo, yung po labang yung pong bibigyan po ng ang pasyente ng immunoglobulin para doon po sa accident na breaking ng hepatitis injection. So i-subside lang po yung immunity pero yung po bacteria na pumasok sa katawan from the pricking, hindi po ba yun bibigyan ng medication?
Mawawala na yun, ma'am. And negative ba? Negative siya? Negative ka, ma'am?
Hindi po related sa anak ko. Yung tulad po yung case lang po natin na just in case na ma-prick yung nurse ng positive na patient na may hepatitis. Kasi medyo po nakakatakot na ma-injection ng hepatitis na bacteria, yun po lang.
Actually naman, ma'am, just a prick lang yun. Ang kaso lang, baka lang kaya we have to confirm whether talaga bang merong positive both yung doon sa part ng pasyenteng nakaprick sa kanya yung needle. Kung negative, ma'am, it's negative. Wala tayong dapat But if there is positive at nagbigay tayo ng immunoglobulin, tapos dun sa result niya, after 3 months of checking, wala naman, so there is nothing to worry. Wala yun. Kung nag-positive siya, by the time na nag-recheck yung kanyang hepatitis antibody, yung titer niya, so that means to say meron. Yun ang iwa-watch out natin. And that to be observed, so bibigyan siya ng another protocol.
Okay po.
So
Very
pag
dangerous.
initially wala, pag initially ma'am wala, so wala yon. Oo. Napaka-interesting ng infection control. Oo. Kaya dito, so I've been practicing as advisor ako from the quality side. So yung ating infection control, sabi ko nga, continuous na learning, yung infection control, para at least kasi yung mga updates, kailangan nating every now and then ma-update tayo dun sa lahat. Kaya masyado akong particular when it comes to infection control. Yung mga articles, marami tayong articles na mababasa kasi. But it should be based reference, yung reference mo. Para hindi ka mawala. Kasi nakakatakot na mag-base.
Nakakatakot nga po.
Yes.
Opo.
So yun. So kaya I'm just happy with my journey dun sa aking experiences, yung na-happy ako na na-share ko ba yung mga experiences na yan.
Thank you, ma'am.
Anyway, yes. Question? Is there any question? Anybody wants to ask question? I'll be happy to answer. Okay. So do you have your pen and your paper with you?
Yes po.
Ready? Okay. So, as I told you, we are going to have a quiz with infection control. So, get it done? Ready? So, I'm going to share the slide with you. Okay, so start now. Do you have it?
Wala pa po.
Sandali, wala pa. Sandali lang. disabled pang sharing ko. Okay. Done. Okay, so it is with you now.
Only 5 lang po, ma'am.
Tapusin nyo muna yan.
Apo.
And her kids completely transformed their back garden from an overgrown.
Done? Done? Tapos na tayo.
Nahirapan sa sagot.
Hello, Ma'am Ann.
Yes.
Yung number 5 po ba, that is enumeration? Like,
Ang tinatanong ko dito is, hindi. Ang tinatanong ko dito is, fill in the blanks. Blank
Apa.
is a set of
Okay po.
infection control. Ano yon? Ano yung set of infection control practices na yon?
Akala ko po kasi yung up to 8.
Yung up to 14?
Apo. Hindi po ba?
Hindi yon.
Okay po, ma'am. Sige po.
Wala akong enumerate doon. Nag-blank
Apo.
ako doon.
Okay po.
Dan?
Of infection control practices is used to prevent transmission. It can be conducted that improves non-intact.
So, going to the next.
Sige po.
Sige na.
Opo. One, two, three, four, five, six.
In order, ha? In order.
ko mabasa.
Done?
Yes po.
Nasaan na yung number 4? Wala akong sagot.
Number 4? Tapos na
Ay!
lahat?
Ay, akala ko po nakamute. Sorry.
Ha?
Sa number 4 po, ma'am, di ko po na ano yung
Okay,
question.
so tapos na lahat dito. I can change it.
Okay po, ma'am. Ako po, ay, medyo tapos na.
So, done na tayo. Dito, tapos
Ay.
na. Ah,
Okay na po, ma'am. Meron po pala akong screenshot ng question. Okay lang po. Balikan ko na lang po sa gallery ko. Ayun, ayun, ayun. Screenshot ko na lang po, ma'am.
okay na. So, lahat bang tapos na? Everybody had done? Finish? So, if you are done, just put your name on top of the paper and take a photo and send it to our group.
Wala, smile.